Hello class, my name is Corporal Paul Mental, and today I'll be doing my presentation on my chosen article. The article I chose is the From Caterpillars to Butterflies article. This article spoke to me because of its way of relating evidence-based practice to the metamorphosis of a caterpillar of a butterfly, in terms of the changes and how it relates to the implementation of evidence-based practice in healthcare today. So I'm going to start off with what evidence-based practice is. So evidence-based practice, as we all know, involves three components. There needs to be a patient need for the evidence-based practice. There needs to be clinical expertise. So the evidence that's being searched for or being looked into, there needs to be a clinician with expertise or knowledge about the specific topic in order to find the best available evidence to support the practice changes that the individual or the person trying to implement the changes wants. So that basically makes up what evidence-based practice is. So barriers to evidence-based practice. There's lack of knowledge of research. Nurses do not know about the best available research to them, especially as socially educated nurses. Nurses do not difficulty interpreting findings and applying to them to practice. The nurses do not understand research, and because of that, they do not know how to apply them to individual nursing practices. Nurses lack the time, and the increased workload prevents them from finding time to research and find new and available evidence to tackle the issues they face at work. There's a lack of autonomy. The nursing staff lack support from management to research and also find best available evidence to tackle the issues they face. There's lack of authority to change their practice. There's also a resistant workplace culture that could prevent the implementation of evidence-based practice in different workplaces. There's also limited access to different forms and sources of evidence to nurses. Nurses do not have access to probably different databases in your workplaces, because those workplaces probably do not value nursing research as much as some other hospitals or healthcare facilities do. So I'm going to be talking about disciplined clinical inquiry, which is evidence-based practice literacy pathway, which allows nurses to be more empowered and also have more knowledge about what evidence-based practice is, and also ways in which they could use to solve day-to-day issues they face at their workplace. Phase 1 is basically divided into 5 phases. Phase 1 is the identification of these barriers they face at work, and also finding ways and learning about ways in which they could overcome these barriers in phase 2. So phase 2, they become more empowered because of the knowledge they gained in phase 1, and they use the evidence they gain also to find ways to overcome the barriers they face, which I talked about in the last slide. Phase 3 is when they use the knowledge they gain from learning about these evidence to try to cause changes in practice in your workplace, and also create new ideas and knowledges that the nursing practice could be revolved around. Phase 4 is the implementation of these evidence-based practices to improve the care that patients receive. Phase 5 is the evaluation of the evidence-based practice implementation, and also looking at the outcomes of this evidence-based practice implementation. So I'm trying to play this video, but it's not working. But it's very simple what I'm trying to explain here. I'm trying to explain the metamorphosis of a butterfly in terms of how it relates to the different phases I just talked about. So the egg stage is basically the identification stage, the stage where nurses identify the barriers that impedes on them trying to make evidence-based practice a culture in your workplace. Stage 2, which is the caterpillar stage, is when the caterpillar is eating and growing and becoming bigger. As the nurses eating, basically, are learning these new evidence-based skills and also trying to find ways to overcome the barriers they face. And the barrier that the butterfly or the caterpillar faces is the cryogenesis phase, where it grows and transforms. So there's a struggle through this growth in the cryogenesis phase, as it's seen in this picture right here. So this is the cultivation of new knowledge and learning of new knowledge, and then trying to find ways and means to implement this knowledge in the hospital. And this is basically the phase that we're in, I think, in our program, where we're trying to learn about these new ways and trying to find ways to implement it in our respective healthcare facilities. Stage 5 is when it becomes a butterfly, when it becomes big and it's implemented in a healthcare facility and there's growth going on. Phase 4 and 5 basically is in the butterfly phase, because 5 is when the butterfly lays new eggs, and the new eggs is basically trying to evaluate what's going to happen and trying to make the practice or the new evidence-based practice a culture in the workplace through the laying of eggs, and also trying to find new champions to move the evidence-based practice in the care of the hospital. So there's 4 different monarchs that this evidence-based practice changes and implementation goes by. So the 4th quads is the pillar. The pillar is divided into 4 pillars. It's the DCI model, which is the one I talked about. The professional practice model, which is basically the recognition of nurses as the nursing profession, recognition of nursing. The nurses as the nursing profession, as a profession that utilizes evidence. The accountability system. That's the 3rd pillar. Is the new and reformed accountability on both the nurses and the nurse leaders to implement evidence-based changes in their practice. The reward system is the identification of these struggles of nurses and trying to reward them by the CNO due to their contribution to the implementation of evidence-based practice in their respective areas of care. So partnership as the 4th quad also kind of deals with the accountability section. It basically try to find ways where leaders and bedside nurses form a partnership that makes both voices being heard and also listened to in terms of trying to implement evidence-based practices in your care, and also tries to form a team-centered approach and the implementation of evidence-based and practice. The principles and pathways to 3rd and 4th monarch quads. This is the development of a culture, principle and idea that evidence-based is something that we should go for, and it's something that improves the care that patients receive. So it's trying to find a way in which the engagement and also excitement about nurses, it's found in both leaders and nurses to instill a culture that promotes evidence-based practice in their care, and also trying to find aligned means and ways in which this form of care it's implemented and instilled in the care that patients receive while in the hospital. The last stage is the involvement of nursing leadership and care. Nurse leaders, as leaders of an organization, it's a requirement of them to create an environment that supports the transformation of care from the outdated principles to new traditions. An environment that's supportive of autonomy of nurses and creates innovation and advances in knowledge. It also creates a meaningful nurse leaderships also create meaningful research results to become common language with clear implications for practice such as the monarch quads. Lead the way in clinical settings to engage and empower nurses to ask practice questions and also create evidence-based champions in the hospitals. This is my references. Thank you so much.